Hello, and welcome to today's web seminar, Making a Positive Impact on Patient Care, a case study of Children's National Medical Center Clinical Laboratory, brought to you by Guidon Performance Solutions and Children's National Medical Center Clinical Laboratory. I'm Melissa Sopwith from Guidon, and I'll be your moderator today. Before we begin, we have just a few announcements. First, there will be a Q&A session at the end of the presentation. You can participate in this Q&A session by asking questions at any time during the presentation. Just type your question into the Ask a Question text area in the bottom corner of your screen and click the Submit button. We will collect all questions throughout the presentation, and our presenter will attempt to answer as many as possible at the end. You may also enlarge the slide window at any time by clicking on the Enlarge Slide button located below the presentation window. The slides will advance automatically throughout the event. If you experience any problems with the program, please press the F5 button on your keyboard or close your window and relaunch the presentation using the other media player. You can also visit the webcast help guide by clicking on the help button below the slide window. Leading today's discussion will be Dr. Joseph Campos. Joseph is the director of the Microbiology Laboratory, Molecular Diagnostics Laboratory, and Laboratory Informatics at Children's National Medical Center in Washington, D.C. He obtained his A.B., M.A., and Ph.D. in bacteriology from the University of California, Berkeley. Joseph is a tenured professor of pediatrics, pathology, and microbiology, immunology, tropical medicine at George Washington University Medical Center. And he is board certified by the American Board of Medical Microbiology. Joseph is currently serving his fourth year in the elected position of Secretary of the American Society for Microbiology. Now on to the presentation. Joseph will start by discussing healthcare and laboratory testing using Lean. He will then talk about the 5 Lean principles that apply to the laboratory, and he will go into more detail on 3 case studies from his lab: microbiology lab workload and staffing data, microbiology incoming work cells, and automated culture plate inoculation. Joseph will also discuss the difference between the traditional approach to microbiology testing versus a Lean approach. Joe, I will pass the presentation on to you.
Thank you, Melissa. It's a pleasure to be part of this webinar. Healthcare in particular and laboratory testing specifically are apt targets for a Lean analysis in the healthcare setting. Healthcare and laboratory testing presently account for quite a bit of waste in the U.S. healthcare system alone, with estimates ranging all the way up to $850 billion per year. A Lean overhaul of the hospital laboratory, while just a small fraction of that amount, can eliminate a good deal of wasteful activity and inactivity, reduce costs, improve patient outcomes, which of course is something we're always interested in doing, and provide for a safer healthcare encounter. The main objective of a Lean laboratory reorganization is to deliver the highest quality of test results at the lowest cost within the shortest time frame possible, while improving the physician and patient satisfaction with the laboratory test results. The deliverables that one expects to obtain with a successful Lean laboratory reorganization are summarized on this slide. One is to see improved operational performance in the laboratory. Second, standardized processes that can greatly facilitate and streamline the flow of work in the laboratory. The elimination of errors during testing can be aided by the incorporation of a Lean philosophy. Better employee morale is something that follows naturally, since laboratory employees, like all other healthcare employees, are very interested in helping patients get better sooner. And finally, we want to increase both patient and employee safety when it comes to laboratory testing. The laboratory itself is a potentially hazardous workplace, and by incorporating standardized procedures in a streamlined setting, one can minimize the chance of errors in the laboratory that might harm the workers. There are 5 Lean principles that I'd like to discuss briefly that apply to the laboratory within the healthcare setting. The first summarized as value. And within this principle, we are striving to increase the value of testing from the physician and patient perspective. Every activity in the healthcare setting should add value to the patient's encounter with the healthcare setting, and laboratory testing is no exception to that. The second principle is the value stream. A value stream is a process in which we define the steps of laboratory testing processes and decide how we can eliminate wasteful activity and inactivity from the value stream. I will be going over some examples from our laboratory a little bit later. Third is flow. Ideally, we'd like to have the flow of work through the laboratory be as evenly distributed as possible, realizing that that's not ever going to be reality because specimens arrive in the laboratory sometimes in batches. Nonetheless, even if a large batch of specimens arrives, we want to be able to begin the working on that batch in a even and constant fashion, so that there's not a lot of pressure-induced mistakes being made during the testing. Fourth, pool. We want to maintain a just-in-time inventory of supplies. The pool refers to having supplies that are necessary for what we need to do and not having an excess inventory that is waiting to be used and perhaps deteriorating in quality and filling up storage space that could be used for other purposes. And finally, perhaps the most important principle is that of continuous improvement. Once a laboratory undergoes a lean analysis and implementation of some of the recommendations from that analysis, we want to continue to seek perfection by constantly reviewing the steps of our testing processes to make them better and better as time goes on. Now I'd like to turn to what we have been doing at Children's National Medical Center in the microbiology laboratory. When we decided to engage in a lean analysis with the Guidon Performance Solutions Company, the first thing that we had to do was to supply some information to Guidon. And most of that information dealt with the workload in our laboratory and the staffing that was available in the laboratory to perform that workload. That was submitted to Guidon ahead of time. The actual visit from Guidon constituted a 3.5-day laboratory assessment, and it was conducted within our laboratory by representatives from Guidon. We decided to focus on two of the heaviest workloads in our microbiology laboratory, namely blood culturing and urine culturing, and value streams were created for both of those processes within our laboratory. As a result of the data submitted and the on-site evaluation of our workflow, Guidon prepared a set of recommendations that regarding the maximal use of our available staff. They highlighted some opportunities for automation in the laboratory to eliminate waste, and they also suggested ways in which we could more efficiently use our existing laboratory space. Now, I'd like to go through a couple of concrete examples, beginning with this slide, which is entitled Microbiology Testing, the Traditional Approach. Realizing that most members of this audience probably are not familiar with the way microbiology labs operate, I thought I would include this slide to show how most microbiology laboratories today, including our own prior to the lean evaluation, operate when it comes to performing cultures. I've divided the slide into 4 sections entitled Day 0, Day 1, Day 2, and Day 3. And if we can look at the Day 0 box, what I have done there is I've divided the 24 hours of the day into 2 segments. One that begins